Heart attack and how to treat heart attack. A heart attack is a serious heart disorder when the heart muscle doesn't get blood flow. This condition will interfere with the function of the heart and flowing blood throughout the body. Heart attacks can cause death if not treated immediately. Heart attack, also known as myocardial infarction, occurs due to obstruction of blood flow to the heart muscle. The main cause of this condition is coronary heart disease. Coronary heart disease occurs when the coronary arteries that supply blood to the heart are blocked. This blockage occurs due to cholesterol deposits that form plaque on the walls of blood vessels. 1. Symptoms and complications of a heart attack. Symptoms that sufferers of a heart attack can feel are chest pain, shortness of breath or heavy breathing, dizziness, anxiety, cold sweat, nausea, vomiting, or abdominal pain. However, there are also heart attack sufferers who experience no symptoms and immediately experience sudden cardiac arrest. A severe or late heart attack can cause several dangerous complications. These complications include heart rhythm disturbances or arrhythmias, heart failure, cardiogenic shock, and cardiac arrest. 2. Signs. However, it is wrong to say that a heart attack comes like a thunderbolt in broad daylight. A heart attack is the catastrophic culmination of a long-lasting destructive process, which often involves emotional shock, physiological confusion and mental exhaustion. The early warning signs are so subjective and so subtle, that even a doctor trained to measure things objectively can ignore them. 3. Diagnosis. Based on the clinical symptoms felt by the patient or seen by the doctor, a doctor can make a reasonable estimate of whether the symptoms suggest a heart attack or not. His suspicions may be strengthened by the appearance of the sufferer, the level of blood pressure and heartbeat sounds. The doctor may send him for an ECG and blood test, but if he still feels pain, the doctor will probably give him an injection that removes pain before the examination. This is because the excruciating pain can lead to a deeper abyss, which can cause cardiac symptoms. The pain can also cause long-term psychological impact. The first ECG may not show signs of heart attack and possibly the examination should be repeated. Sometimes the second test still shows no change, and during this case, the diagnosis will rely on blood tests. 4. Classification of 5 types of heart attack. Type 1, spontaneous heart attack, due to ischemia due to something in the coronary arteries such as plaque fall/tearing, fissuring, or dissection. Type 2, heart attack secondary to ischemia, due to increased oxygen demand or reduced oxygen supply, for example coronary artery spasm, coronary embolism, anemia, irregular heart rhythm, arrhythmia, high blood pressure, or low blood pressure. Type 3, sudden unexpected cardiac death, including cardiac arrest, often with symptoms suggestive of ischemic heart attack, accompanied by a new ST elevation, or left bundle branch block, LBBB, or the occurrence of a fresh thrombus in a coronary artery due to angiography and/or at autopsy, but death occurred before a blood sample was obtained, or before the appearance of cardiac biomarkers in the blood. Type 4, associated with coronary angioplasty or stents. Type 4A, cardiac arrest due to percutaneous coronary intervention, PCI. Type 4B, cardiac arrest due to stent thrombosis on angiography or autopsy. Type 5, cardiac arrest related to CAB. 5. Treatment and prevention of heart attack. Treatment for a heart attack aims to restore blood flow to the heart as soon as possible. The treatment method can be in the form of administering drugs or placing a heart ring, depending on the level and time of the complaint. Heart attacks can be prevented by living a healthy lifestyle, such as 1. Increase consumption of good fats and fiber. 2. Maintain ideal body weight. 3. Manage stress well. 4. Exercise regularly. 5. Stop smoking. 6. Get enough rest and sleep.